ice bath one time for you, so you remember the procedure. If you're doing a contrast bath, so for the ice bath, you just need one bucket. But if you are doing a contrast bath, so one is cold and one is hot, then you need to have 2 buckets. Okay? Now, in a practical exam, I'm going to prepare the water inside the buckets for you. So you do not need to worry about spending 5 minutes at the sink trying to fill up the water bucket. Okay, so don't worry. There will be water inside the bucket. The only thing that you need to think about is the level of water. So you may need to pour some water away if you think it's too much water. Right. So, okay, so for the level of water we have here, this is okay for like a lower ankle sprain, inversion sprain, anything like that, maybe deltoid ligament on the inside. This water level is up to here, so it's probably not appropriate for a high ankle sprain. Okay, but more for a low ankle sprain. Alright, so let's get started. So you have your patient here, you want to do some assessment over the treatment area. Okay, so if you have already seen your patient, you do not need to ask the contraindications again. Actually, you also do not really need to check the skin sensation again because you know that the skin sensation is normal. But for the sake of the video, we're going to do so. So could you please put your foot up here? Is that comfortable for you?
Yeah.
Alright, so can you show me where is the ankle sprain?
Right.
Okay, so this area here. Ah yes, I can feel there's a bit of swelling and there's some heat as well. And there's also some bruising and swelling over the front of the foot. So on a scale of 0 to 10, how painful is it right now?
It's like 6.
6. Okay, and if you stand on it, will it become more painful?
Yeah.
Yes. So how high is the pain then?
I think maybe like 8.
Or even 8. That's
Yeah.
very high pain. Okay. So in this case, I'm just going to check that your skin is okay to go ahead with the ice bath and also check some contraindications for you. Great. So the first test we're going to do, now you've had ice therapy before, so I do not need to check your ice allergy test, but I do want to check your skin sensation one more time. So this one is blunt, this one is sharp. Okay. And please close your eyes. I'm going to test the whole foot area.
Blunt. Blunt. Sharp. Sharp. Blunt. 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 Blunt.
That's hard.
Blunt.
Are you sure?
Really?
It's okay because you have harder skin underneath.
Sharp.
Yes.
Sharp. Sharp. Sharp.
Yes.
Blunt. 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 Sharp. 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 Blunt.
Yep.
Sharp.
Yep.
Sharp.
Good.
Sharp. Blunt. Sharp. 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 Blunt. Blunt. Sharp. Blunt. Blunt. Sharp. Sharp.
Okay, that's very good. Now, for the immersion bath, ensure that you check the whole area that you will immerse. Also, underneath the foot, the skin is thicker, so sometimes you need to press a little bit harder, but do be careful. It's better if you have a false test first, instead of really pushing very hard with the needle. So, yes, be careful. Okay, so this next test we're going to do is the hot and cold test. Okay, so this one is warm, this one is cold. Alright, so close your eyes again.
Cold. Cold. Warm. 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 Cold. Warm. warm, 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 cold.
Okay, so that's good too. Alright. So the next thing that we will do, we'll check some contraindications as well. So just like last time, I had to ask you if you had cryoglobulinemia, which is a precipitation of proteins in the bloodstream in response to cold. How about hemoglobinuria, Berger's disease, Raynaud's disease? You don't have any ice allergies or no vasospasm diseases. Your general health is good. I don't need any medication. Okay. In that case, you also have no hemorrhaging conditions. You do not have any acute DVT or thrombophlebitis, no tuberculosis. Anything that I forgot? Yes. Okay, so you have to inspect the skin of the whole immersion area. So I can see that your skin is in good condition, it's intact. Capillary refill is very normal. Alright, so I think we're ready to start. Okay, are you ready? So let me take my and one moment, I will put this on the floor to make sure that there is no water spill. And this is our water bath. I have to prepare it first to get it to a temperature between 13 and 18 degrees. So let me measure the temperature first. So it is above 20 degrees, so I definitely have to cool it down by adding some ice. Now, it's good to take a spatula to stir the ice bath. Do not use the thermometers to stir the ice bath. And then just keep reading the temperature. It should reduce to anywhere between 13 and 18. 18 is actually quite warm. So right now it's at 17. I'm a little bit wise. And now the temperature is reducing to 15. Okay, it's stable at 14. Alright, so we are ready to start. Now what we'll do, I will set the timer to 10 minutes. Okay? During this 10 minutes, try to keep your foot inside. I will keep agitating the water for you. So we've got 10 minutes on here. If at any point you can't tolerate it, you can take your foot out. Okay, and then dry it. And I will stop the timer.
Okay.
Okay, are you ready?
Yes.
Let me put this one close to you. Okay, and then put your foot inside. It is better if you kind of suspend the foot. It's a little bit cold. It's 14 degrees. So it's a good idea if you suspend the foot. I mean, you can do that if the patient is sitting on the plinth, and then you can adjust the height of how he's sitting. Right now, his foot is actually on the floor of the bath. So depending on what you're treating, this may not be suitable. But I think for ankle sprain, maybe both. If you want to take your foot out, please do. Are you okay? Should probably stop the timer too. Is it very cold? So you should feel extremely cold, maybe some achy cold, some that needles, and even numbness. Okay? So if you can't tolerate it, take your foot out. You don't need to be super brave. Okay? Very good. Stop the timer, that's right. Okay. Very cold, okay. It's really cold. This is a normal reaction. Now, with ice bath, the first time you do an ice bath is definitely the worst. Afterwards, you do kind of, okay, I'll start the timer again. Afterwards, you do kind of get used to it. And it just takes practice. This is one of the things that takes practice. Remember that you have to agitate the water. Otherwise, I will not mark you very highly because the treatment is not effective. If you don't agitate the water, what you have is you have a gradient build up around the skin where it doesn't feel that cold. But you can see as I'm agitating the water, he's feeling, wow, it's really cold. I'm not giving him any relief. Okay. So how are you doing? How do you feel?
Very cold.
Very cold.
Yeah.
Okay. Okay, it's now halfway through the treatment. You're doing very well.
Thank you.
Do you feel any burning or any
No,
achy
just very
feeling?
cold.
Just very cold.
Numb.
Numbness already. Okay, but that's quite normal.
Yeah.
Okay, it's now the end of the treatment. So I'll let you take your foot out. Move the water bucket away. And then just sit there for a little while. After the treatment, it's quite normal for your foot to feel a bit numb. So don't put weight on it immediately.
Okay.
What we can do now is we can do some ankle range of motion exercise that are pain-free, in your pain-free range. Here you get your MSK equipment, you get your ankle exercise and things like that. And we also check your outcome measures. For example, the pain level right now, how painful is it? From 0 being no pain to 10 being the worst pain.
Nowadays, like 4. Yeah.
Okay,
Like that.
so it really works. And then you can also take the ankle circumference, of course, anything that you're thinking of. All right. Great.
Are we
Thank
done?
you. All done.
Okay.
Yes.